All right, everybody, welcome to another deep dive. Today we're tackling something I think a lot of you are curious about, maybe a little nervous about, or just want to get informed about. We're diving deep on mammograms.
Mammograms, yep.
I'm excited for this one.
Why?
This is something that I think impacts a lot of our listeners.
Mm-hmm.
And, whether you're prepping for your first mammogram or you've been through it a bunch of times or you just want to know what's going on, you're in the right place.
That's right. I'm really glad to be here to help break down the science and hopefully put some minds at ease about mammograms.
Exactly. Ever wonder what really goes on during a mammogram? Or why they're considered such a big deal for women's health?
Yeah, it's a really big deal.
Well, let's get right to it. So first things first.
Yep.
Let's demystify mammograms. What exactly are we talking about here?
Yeah. So in the simplest terms, a mammogram is an X-ray.
Okay.
But it's an X-ray that's specifically designed to look at the breast tissue. And it uses very low doses of radiation to take these images. And what's amazing about these images is they can reveal abnormalities in the breast tissue, sometimes even before you can feel anything.
Oh, wow.
And that's the key here.
So we're talking early detection.
Early detection is the name of the game, absolutely.
Okay, so I think, like me, a lot of people, especially if you're about to go through your first one,
Yeah.
you're probably wondering what actually happens.
Yeah.
So let's talk about what goes on inside that mammogram machine.
Right. So each breast is placed between two plates.
Okay.
And those plates gently compress the breast tissue, which I know that part can sound a little scary to some.
Yeah, I remember that part.
But it's so important. The compression spreads the tissue out to make sure we get a clear picture. It's kind of like, imagine trying to read a book, but all the pages are crumpled up.
Great.
It's a lot easier to read if they're all nice and flat, right?
Yeah.
And that compression only lasts for a few seconds.
Yeah.
It just helps the radiologist get a really good view of the breast structures, the ducts, the lobules, the different kinds of tissue.
So all the good stuff.
All the good stuff. And they also take pictures from a couple of different angles.
Got it.
Just to get a thorough picture of the breast.
So the radiologist gets these images. Then what? What's the radiologist actually looking for in those mammogram pictures?
Yeah. Radiologists, they really are like detectives.
Oh, I like that.
They're trained to look for anything suspicious in these images. So that could be masses, which could be lumps or tumors, calcifications, which are these tiny little calcium deposits, and also architectural distortions, which is basically changes in the patterns of the breast tissue.
Ooh, I always wondered about that architectural distortion thing. Can you explain that a little more?
Yeah, so architectural distortion, that's basically when the normal, tissue pattern of the breast gets disrupted or pulled in a weird way.
Yeah.
And that can actually be a sign that there's a tumor, even if we don't see the tumor itself yet.
Oh, wow. So it's almost like the tumor is creating this like pulling effect that they can see on the images.
Exactly. It's like, a little tug on the surrounding tissue.
Fascinating. So the radiologist is looking at all this. I know they're like highly skilled professionals. But let's say they do see something that needs more investigation. What happens next?
Well, if they see something questionable on the mammogram, they'll probably recommend some additional testing. And this is when we get into beyond the initial mammogram. So sometimes they'll order a diagnostic mammogram.
Okay.
And that's just a mammogram that focuses in on a specific area.
So like a zoom in.
Yeah, exactly.
Yeah.
Like a zoomed in picture. Another common test is an ultrasound.
Ultrasound.
An ultrasound's really helpful because it can tell the difference between a solid mass, like a tumor, and a cyst, which is just a fluid-filled sac that's almost always benign, not cancerous.
Oh, that makes sense. I can imagine that's where the anxiety can really ramp up, right?
Yeah.
Waiting for the results of those extra tests.
Oh, absolutely. It's natural to feel anxious.
Yeah.
But it's really important to remember that most of these findings turn out to be benign, not cancer.
Okay.
But sometimes a biopsy is needed to be absolutely sure.
Okay. Let's talk about that then, biopsies. What are the different types and what can someone expect?
Right. So there are a few different techniques. There's a fine needle aspiration.
Okay.
And that uses a very thin needle to extract some cells from the suspicious area.
Okay.
There's a core needle biopsy, and that removes a small tissue sample. And then sometimes a vacuum-assisted biopsy is used. And that's basically just a way to get a larger tissue sample with a single needle insertion.
Okay.
All of these procedures are done with local anesthetic, so the discomfort's usually pretty minimal.
So you're not, totally out of it. It's not like a big surgery or anything.
Right, exactly.
And so that biopsy is what gives like the most definitive answer.
Exactly. The biopsy is the gold standard for actually diagnosing breast cancer.
Okay, so we've been talking about mammograms in general, but I know there are different types. What's the main difference between them?
Yeah, you're probably thinking about screening mammograms and diagnostic mammograms.
Right.
So a screening mammogram is what you get routinely,
Okay.
even if you don't have any symptoms.
So that's like your regular checkup.
It's the regular checkup. Yep, it's all about catching things early. A diagnostic mammogram, on the other hand, is ordered when there's already a concern.
Okay.
So maybe you found a lump yourself, or you're having unusual nipple discharge, or maybe something suspicious showed up on a previous mammogram.
Okay. So it's almost like screening is like casting a wide net, and then diagnostic is like zeroing in on a specific spot.
Exactly. It's a targeted approach.
Okay. So we know that regular screening is key here.
Mhm.
But like, how much of a difference does it really make in terms of outcomes?
Well, honestly, mammograms are pretty incredible.
Okay.
They can actually detect breast cancer up to 2 years before you can feel it. Yeah. And that earlier detection means earlier treatment, and that can make a huge difference in terms of outcomes. Studies have shown that regular mammogram screening can actually reduce the risk of dying from breast cancer by 30 to 40%.
Wow. That's really powerful. Okay. Now, I've heard a lot about 3D mammograms lately. What are those all about? And that's something our listeners should be asking their doctors about.
Oh, yeah. 3D mammograms, they're also called tomosynthesis.
Tomosynthesis.
They're a newer technology.
Okay.
And they basically give a three-dimensional image of the breast.
Oh, wow.
So think about like a loaf of bread, a traditional mammogram. It's like looking at a flat picture of the loaf. But with 3D, you can actually see each slice of bread, you know.
That's a great analogy.
Yeah. And that makes it much easier to spot anything abnormal that might be hiding in the tissue.
Oh, that makes sense.
Yeah. Studies have shown that 3D mammograms can definitely improve detection rates, especially for women with dense breasts.
Okay. And breast density, I've seen that on forms and stuff.
Yeah.
Why is that so important when we're talking about mammograms?
Yeah, breast density basically refers to how much fibrous and glandular tissue there is in the breast compared to fatty tissue.
Okay.
And dense breasts, they can make it a little trickier to read a mammogram.
Oh, why is that?
Well, both dense tissue and tumors, they both show up white on the mammogram images.
So it's harder to tell them apart.
Exactly. It's like, trying to find a polar bear in a snowstorm.
Right. Blends right in.
It can blend right in. So if you have dense breasts, your doctor might recommend some additional screening methods,
Okay.
like an ultrasound or even an MRI.
Got it. So much to think about here. I know I feel way more informed already. So for our listeners, just to kind of wrap things up, what are the key benefits of mammograms that they should be walking away with? Why is all this so important for their health?
Okay. So the takeaway is mammograms are a powerful tool in our arsenal for fighting breast cancer. They're non-invasive, they don't involve any needles or incisions, they're quick, they're easy. The whole thing usually takes about 30 minutes, tops. And they're also widely available.
Right.
Most hospitals and imaging centers offer mammograms, and the best part is they're often covered by insurance. So it's a really accessible screening tool.
Okay.
And most importantly, mammograms can detect cancer early, which, as we talked about, can dramatically increase your chances of successful treatment and survival. And even if your mammogram comes back normal, that can provide such incredible peace of mind.
Yeah. I think a lot of people forget that. It's not just about finding something, it's also about that reassurance.
Absolutely. It's about knowing where you stand.
Yeah, fantastic. Well, I learned a lot today, and I'm sure our listeners did too. Before we go, any final thoughts or advice you want to leave with our listeners about mammograms?
Yeah, I would just encourage everyone to talk openly with their doctor about mammograms. Discuss any risk factors that you might have, any concerns that you have, and figure out together what kind of screening schedule is right for you. And remember, knowledge is power. The more you know about mammograms, the more empowered you'll feel to take charge of your health.
I love that. So well said. And for our listeners out there, remember that early detection can truly be a lifesaver. So be proactive, ask questions, and advocate for yourself. That's the real key message here today. Thanks for listening, and we'll catch you on our next deep dive.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.